NoviMedicine is an online and soon-to-be mobile application that allows analysis and recommendations regarding dermatologic problems. Right now, it's acne-focused, but eventually, and in the near term, we're going to add other dermatologic complaints. And regarding the genesis of the idea, I was a resident in dermatology at Mayo Clinic, and there are quite a few people that came from quite far away to get some dermatologic helps. So there is the access issue, and waiting for 3 months, 6 months for a dermatologist to me seemed a little insane, when some dermatologic complaints can be easily dealt with some key pieces of information and a few images. And teledermatology and dermatology online, dermatology remotely has been around for 20 years, but there have been a couple hurdles. I think that what we were able to do is to make this fast and efficient enough that we can overcome at least one of the hurdles, which is reimbursement. And how does this work for the system? How does it work for the dermatologist? How does it work for the patient? Doing something like this and delivering care, or even stepping into the healthcare space, it's not like building Angry Birds or building an iPhone app that's a game. There are real issues around the sensitivity of the information. There are real issues around the recommendations, and just that the stakes are a bit higher in medicine, and certainly in delivering medical care remotely. Then you add on top of that the regulatory environment, which is all over the map. I'd like to see some of the regulations regarding telemedicine and telehealth loosened up a little bit, and they are starting to, but it's a state-by-state issue. Senator Udall was is going to introduce a bill into Congress, into the Senate, about making licensure for telemedicine a little bit easier, because right now, I'm in California, and I can't treat someone in Texas or in North Dakota. And there are so many stakeholders in medicine and in licensure. That in itself is one of the big hurdles, and how that plays out in regulation, is going to have a tremendous effect on us. Ideally, we'd love to see a national plan for it, since this, telemedicine doesn't pay attention to the border between Nevada and California. But I think that's asking for a little bit. It's a little pie in the sky at this point. And then the second part of that would be to come up with some reimbursement regime whereby insurers and public payers like Medicare, Medicaid, Medi-Cal can reimburse providers for those services. And they do exist to some extent, Medi-Cal, for example, but it's a little bit clunky, a little bit unclear, and it's certainly not in every state. This is my first Health 2.0 conference. First of all, it's very encouraging to see so many people doing so many things. And there's the Rumsfeldian, there are known knowns, known unknowns, and unknown unknowns. I think the most surprising thing for me coming here are the unknown unknowns, what people are doing, what the problems of some of the larger players really are, which I think is where a startup can really make its mark. So, and also, cut out a lot of missteps. So identifying or working with a larger organization, be it a healthcare provider, be it a payer, to identify what are their problems, what are their needs, and work with them in some capacity to address those. And even in the generative stages for a startup and the ideas, think, okay, what are these guys' needs? What are their problems? I think is very orienting, very helpful. And that was certainly a theme at the Health 2.0.